We know that suicide is the third leading cause of death for young people aged 15 to 29 in Latin America. Tell us about the correlation between mental health and suicide rates in the region.
You bring a very important topic in the region of the Americas. It's not only the fact that it's the third leading cause of death among young populations, but the region of the Americas also is the only region among the different WHO regions where the suicide rate continues to increase. In fact, there has been a 17% increase in the regional suicide mortality in the last 20 years. The situation in the Americas in terms of suicide is very heterogeneous, but I think I can simplify by telling you that you have very high rates in the Caribbean, you also have high rates in North America, and in the Southern Cone, you have countries where suicide continues to increase. There are many reasons for that. They are particular to each of the different countries, especially because some countries, it's young populations that die more by suicide. In other countries, it's older populations. So what we really believe is that suicide and suicide prevention needs to be taken seriously, needs to be at the top of the public health agenda of countries so they can implement strategies that can change this situation. Because the most important is to know that suicide is preventable.
Preventable. Tell us about the aspect of mental health with what you're seeing.
Yeah, mental health is one very important part of suicide prevention. We know already what works. What works is limiting access to means. It is also media communicating responsibly. But when it comes to mental health, there are two types of interventions that are very important. One is to work with young people at schools, improving their capacity to deal with the adversities of life. So this is an area where we try to increase resilience, improve mental health in a way to reduce suicide. And the other aspect of suicide prevention that it's very connected to mental health and to mental health services is the development of services that can identify people at early stages of a crisis or suffering and provide mental health support, follow-up and care in a way that the issues that people are facing that could lead to suicide are addressed as early as possible. If we are able to implement those strategies in countries, we know that we are going to be able to reduce suicide.
What was the impact of the COVID-19 pandemic on mental health in the region? And now that we're coming out, we're a few years away from the pandemic, are you still seeing impacts? And really, what have you learned from that?
We have worked very hard during the pandemic. And at the beginning, we were able to put together some studies that showed that in the region of the Americas, conditions like depression and anxiety had increased. And that allowed us to alert the countries that they needed to do something, that they needed to expand services or avoid that services were interrupted. So since the beginning, we were able to have a picture that the situation was not good for mental health. And there are many reasons for that. After COVID, countries, I think they learned that the importance of mental health in people's life. Mental health got much more visibility. So we are using that opportunity to help countries to reinforce their capacities to deliver mental health.
There is more public awareness about mental health, but stereotypes and prejudice continue to persist, creating challenges for those seeking help or even acceptance.
There is a lot of stigma, and this is one of the main barriers to care. Here at the Pan American Health Organization, that's one specific area of work that we have developed, aware that even if services were available, because there are many areas in the region of the Americas where services are available, but people still face challenges to reach those services. And stigma plays a major role because people are afraid that others would know that they have a mental disorder, or even the fear of being discriminated by health providers when they disclose that they are facing a mental health issue. So the work that we have been doing over the years is, first we created some courses that countries could use to train their health professionals on how to tackle stigma. A few years ago, we also launched a campaign, and the campaign was based on the fact that it's important to talk about mental health, because if we all talk about mental health, people will feel that mental health, it's part of daily life, are part of things that everyone will face at some point in time, and that will gradually help to reduce stigma. But we have a very long way to go.
When it comes to certain populations, like indigenous populations in the region, what are you seeing? Are you seeing any improvements? And how are people in indigenous communities getting access to help?
Unfortunately, when we look at the proportion of people that are under care 2-3 years ago and we compare with the data now, we don't see changes. So as I said, despite the visibility, despite the importance that countries are giving to the topic, we still don't see that more people have access to care. And the situation is even worse for indigenous population. Many of them are in isolated or far away areas. There are also challenges on the adaptation of the services that we have to be coherent with what indigenous populations think and believe. So all these are very important barriers, specifically for indigenous populations. We also have some studies in the region of the Americas that show that suicide mortality is much higher in indigenous populations in comparison to other groups.
Any correlations between more vulnerable populations, women, young people, versus men, or by age, for example?
Well, this depends on what mental health condition we are talking about. For depression and anxiety, we know that women are more vulnerable. For suicide, although women attempt more suicide, men die more by suicide than women. And that understanding is very important, because when we are thinking about developing preventative interventions, we need to clearly understand who is most affected, who is more vulnerable, and how we design strategies that can really target the problem, but also the causes of the problem.
Which countries would you say have excelled on their policies related to mental health, and what countries need a little bit more work to improve?
Well, it's good that we also talk about positive things, because in general, when we are talking about mental health, we know that there is a lot that needs to be done. But in the region of the Americas, you have countries who really have set very important examples, models, not only for the region, but for the whole world. If we look into how Chile has integrated the management of depression into their primary healthcare system, that's a very important model and example that other countries have been following. If you look how Brazil, how Peru have integrated the management of severe mental health conditions into the primary healthcare system, creating community mental health centers, helping to deinstitutionalize people that were living in long-term institutions and integrating them into the community. These are also models that have been followed by other countries in the region and countries also outside this region.
With mental health issues on the rise globally, the question is, are there enough trained specialists?
In mental health, definitely this is one of the problems. We don't have enough specialists to deliver the mental health care that the population needs. But on the other side, there are alternatives. We know from the evidence that exists that it's possible to shift tasks to non-specialists, and this can be also effective. So in the past, we used to rely on psychiatrists and psychologists to deliver mental health care. Today, we know that nurses, even lay persons, counselors, if well trained and well supervised, they can deliver care that can be as effective as when it's delivered by a specialist. So that's an area that we have been stimulating countries to adopt such strategies and approaches, because even rich countries don't have enough specialists.
Chief Renato Oliveira, thank you for joining us.
Thank you.